Mitral valve anatomy. The mitral valve apparatus consists of 5 distinct anatomic components. This includes the mitral valve annulus, the commissures, the mitral valve leaflets, chordae tendineae, the papillary muscles, and the left ventricular wall. Mitral valve annulus. The mitral valve annulus is the fibromuscular ring to which the anterior and posterior mitral valve leaflets attach. The normal mitral valve annulus has a 3D saddle shape with its lowest point at the level of the anterolateral and posteromedial commissures. This enables proper leaflet apposition during systole and minimizes leaflet stress. The annulus can be divided into the anterior annulus and the posterior annulus based on the insertion of the corresponding leaflet. The other components of mitral valve apparatus are mitral valve leaflets. The mitral valve has an anterior and posterior leaflet. The atrial or smooth surface is free of attachments, whereas the left ventricle or rough surface connects to papillary muscles by chordae tendineae. The posterior leaflet, which has a quadrangular shape, is attached to approximately 3/5 of the annular circumference. The semilunar anterior leaflet is attached to approximately 2/5 of the annular surface. Although the posterior leaflet attached to a larger portion of the annular circumference, the leaflet is shorter than the anterior one. The leaflet segmentation proposed by Carpenter is the most widely classification used. This classification takes advantage that the posterior leaflet has 2 well-defined indentations, dividing it into 3 separate sections or scallops. The anterolateral scallop is defined as P1, the middle scallop is defined as P2, the anteromedial scallop is defined as P3. The anterior leaflet typically has smoother surface and devoid of indentations. The segmentation of the anterior leaflet opposing P1 is defined as A1 or anterior segment. The segment opposing to P2 is A2 or middle segment, and the segment opposing to P3 is A3 or posterior segment. Mitral valve commissures. The commissures define a distinct area where the anterior and posterior leaflets oppose each other during systole. Carpenter divides them into anterolateral and posteromedial commissures. The amount of tissue in the commissures varies from several millimeters of leaflet tissue to distinct leaflet segments. Mitral valve chordae. The chordae tendineae are responsible for determining the position and tension on the anterior and posterior leaflet at left ventricular in systole. The chordae are fibrous extensions originating from the edges of the papillary muscles and infrequently from the inferolateral left ventricular wall. They are named according to their insertion site on the mitral leaflet. Marginal or primary chordae insert on the free margin of the mitral leaflet and prevents marginal prolapse. Intermediate or secondary strut chordae insert on the left ventricular surface of the leaflet and prevent billowing while reducing tension on the leaflet tissues. This chordae may also play a role in determining dynamic left ventricle shape and function due to their contribution to left ventricular valve continuity. Basal or tertiary chordae insert on the posterior leaflet base and mitral annulus, and their specific function is unclear. Papillary muscles. There are 2 papillary muscles, the anterolateral and the posteromedial, that originate from areas between the apical and middle third of the left ventricle free wall. The anterolateral papillary muscle is composed of an anterior and posterior head. The posteromedial papillary muscle is usually composed of anterior, intermediate, and posterior heads. Because papillary muscles connect directly to the left ventricular wall, any geometric change in the left ventricular shape can change the axial relationship of the chordae and leaflets, resulting in poor leaflet coaptation.